Doctor, good morning. The new guidance is for areas that have a high transmission rate. So how do you know if that's your community?
You know, Robin, since yesterday, this has been a real point of confusion for so many. The best way and the best resource is the CDC.gov website. It has an interactive map and it collects real-time data daily. And it's an aggregate amount of data all across the country. So I just checked this morning, and I was now in the substantial risk versus last week in the moderate risk in my county. And there's 4 tiers on the CDC website. First is low, followed by moderate, and then substantial and high. So as Dr. Walensky has suggested, for areas of substantial or high risk, and perhaps even moderate risk considering wearing a mask, that is the best way. And we can check on a day-to-day basis to really keep on top of the COVID numbers in our area.
How concerned are you this is going to confuse people and make some people go, oh, see, the vaccine didn't work, when that's not what's happening?
Yeah, we have to be very careful about the messaging, and the science behind the vaccine still holds up. You know, the vaccines protect all of us who are vaccinated 94% against severe illness, hospitalizations, and death. So these guidelines don't really speak to the vaccine efficacy. It's still wonderful. What they speak to is the hypertransmissible Delta variant. It's 225% more transmissible. It also speaks to the fact that only 50% or so of our nation is fully vaccinated. And these new masking guidelines are there to protect everyone. And so it's not, you know, I know that there's a lot of confusion and concern that the vaccines might not be as efficacious. The real issue is that because vaccinated people with the Delta variant can contract the Delta variant and most importantly, spread it and transmit it to people who are unvaccinated, putting them at risk. So this real solution is to make sure that we are all vaccinated to prevent this from happening.
Okay, what about if I have a child that's young enough to go back to school and they're going to be in masks again for the school year? For a parent who was looking forward to perhaps them not having to be in masks, what do you tell them?
I sympathize with parents, as I am one, and I know that we want our children to have the most normal school year coming up, given that they had such a different and difficult year last year. But if we want to prioritize in-person learning, we must mask. You know, by and large, over 70% of all school systems are unvaccinated populations. Everyone under the age of 12 is unvaccinated. Only 25% of kids between 12 and 15 are vaccinated, and only 37% of children from 16 to 17. So when you look at an entirety of an ecosystem of schools, you know, K through 12, we're basically seeing large groups of unvaccinated people, and masking is the surest and safest bet.
Dr. Aditi Nerurkar, thank you. Good to talk to you.